Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is the dancing man, David Pryor, providing the patient's perspective.
You know, Bryan, you started out a little laggy there. Like this, there's something going on in the environment today that's got you kind of worn out. So I had to make sure to really make sure you break during your introduction today.
Thank you, sir. Providing levity in this time of craziness. I appreciate it. It's in strange times. And one thing that I know that is different here than in the average dental practice, like my office is shut down right now for everything but emergencies. But we are crazier than ever because emergency teledentistry forms and our pre-screening forms for COVID-19 and So what we're going to be talking about in this podcast, which I'm super excited to announce.
Apparently.
We just like doing. I mean, we launched Upgrade Dental just a couple months ago, our educational platform, where we're doing a bunch of stuff on how to deal with COVID-19. So check it out at Upgrade Dental 19. No. Wow. UpgradeDental.com. So we have tons of great information in there and we've got a free course for you to look at. But today we have another new thing, a big thing.
Gasp.
I think this is, could arguably be, one of the biggest game changers that we've ever worked on. And, I'm really excited to talk to with the community, and the people on this community have a chance to be involved. Including patients, if you're listening, really want them to be involved. And I'm excited to unveil it to the community on this podcast for the first time today.
This is a bold statement. You've hyped it up.
It is. And I'm, as always, I say it every time. I'm super excited to have the patient perspective. And I think like we have taken our discussions around clinical dentistry and technology and implementation of technology and burying the dinosaurs in dentistry in the clinical setting to Upgrade Dental. What we're doing now is, and providing that information there sort of on a deeper level. What we're doing today is we're taking your perspective, Dave, and bringing it to like a stratospheric level, which is called DSI. Dental Standards Institute. I like to think of it as dinosaur sinking initiative, but that's not what DSI stands for. It's for the Dental Standards Institute. Oh my gosh, I think Dave is incapacitated with laughter about the dinosaur sinking initiative.
Yeah.
Oh man. Well, anyway, So what DSI is, the Dental Standards Institute, it is a standard development organization, which I've been working on this for about 3 years. I've been part of the ADA Standards Committee called the SDIC for dental informatics. And I saw a gap in standards within dentistry, several of them actually. And what standards are is basically, you can think of it as like the CDT codes, JPEG, DICOM. Those are all standards that everybody's kind of universally aware of in dentistry. But what I think is missing is standards that are developed with two things in mind: the pace at which the world is moving and the patient's perspective. And that's why DSI exists. So what we're going to do is create the types of standards that get ahead of the problems that have been coming through technology, and there's a big one that we'll talk about, and then also provide the consumerism that's happening in dentistry, and those two are aligned. And I'll give you one, what I think is powerful example of the failures of our industry, not anyone in particular, but of all of us collectively, to respond through standard development. 3 words. Smile Direct Club.
Yeah, I knew that was coming.
Yeah, because some Smile Direct Club. Now, maybe you love it. Maybe you hate it. Maybe you're a patient that's had it and thinks it was great because you saved $500 or whatever. But I think in general, dentists could probably agree that Smile Direct Club has not been good from the patient perspective. They're having people sign NDAs now because the outcomes have been so bad. In my practice, we've seen 2 patients which had to have teeth extracted in my office, my personal office, because their teeth were moved into spots where there's no bone, right? And maybe those are outliers, maybe they're not. I don't know. But what I do know is that I strongly believe that dentistry should be. David's cringing now.
Well, yeah, just thinking about the teeth being moved to someplace where there's no bone and then having to be extracted.
Yeah,
holy crap!
It happens, right? And I mean, I don't want to be. I believe that dentistry should be there should be an oversight by a dentist. And right.
Okay. So you think
controversial statement.
Yeah.
I know. I know.
You're really stretching here.
Yeah. I mean, I would say the same thing about like whitening products being sold in Target. I don't think you have been saying that forever. Yeah. I mean, and look, we give it away for free. Like we do all whitening for free because I don't want to talk to people about Target crap that they bought, the goo that they bought that was sitting there on the shelf. And I mean, why? This isn't a financial thing. This is, for me, is a patient advocacy thing.
Yeah.
Right. And I believe strongly the reason why both of these things happened is that we as an industry haven't been keeping pace with how quickly things change in the real world, which is hard outside of dentistry.
Yep.
Things move fast. We move slow. Big part of the reason why I do this podcast.
Yep.
And also, we're not really looking at it from the perspective of what's best for patients from a safety standpoint. Nobody's really focused on that. There are groups, but I don't think that they're really. I think we failed. That's why they're selling goo in Target. That's why there's Smile Direct Club. But there is this sort of what it's called in healthcare in general. It's called consumerism, right?
Okay.
Which means that we have to pivot to what consumers are looking for because they're really making these demands that they didn't used to in healthcare. I view it differently. I view it as us not responding quickly enough to what people want. You're processing.
Yeah, I am.
I can hear the squeaky wheel. The mouse is going, man.
Well, the mouse is waking up. It's not really going yet. But
you're only about a quarter of the way through your Mountain Dew today.
Right. I've got a lot of work to do on the Mountain Dew today.
By the way, you have a clear glass today. Normally, sometimes when we do this podcast, you don't have the clear glass.
Right.
The color of your Mountain Dew, that is like,
it's in a purple translucent glass.
Man, I like if you were a judge on Chopped, I'd be saying, how can I eat or drink something that's that color?
This is from the guy that's addicted to coffee. Brown sludge of a product that you drink.
Not in a clear mug, however. I'm not exposing you to my sickness.
Oh.
Sorry, I don't even know I was asking you about the Smile Direct Club and consumerism being one way to look at what's going on. Another way is the industry, healthcare in general, not keeping pace with the rest of the world.
Yeah, I mean, I as a patient can't conceive of a Smile Direct Club as an option. I think that people look at the internet and say the internet has all the answers. The doctor, they equate themselves to having, if I just look something up on the internet, I know as much as the doctor. And I think everybody listening to this podcast certainly knows that's insanity. Mm-hmm. And so, but I think that's the impetus that's going to give people like, Smile Direct Club seems like a good deal. And if I knew that I could have my tooth moved to an area where there's no bone, and then I'm gonna, it sounds like something that's incredibly painful, and then B, I'm going to lose that tooth. So I'm gonna do something that I'm trying to make my teeth look better, and then I'm going to be in a ton of pain for no reason.
Well, these people weren't in pain. They came in, they're like,
right.
Why are my teeth loose?
Right.
Oh, because there's no bone.
Right. And then now I'm going to lose my tooth because I tried to save a few bucks. $500. My smile is worth more than $500. And so I'm like, holy crap, that's a big deal.
Yeah, and I just, that's one example. But overarching, what I'm saying is that we can get ahead of these things. We can come up with standards. We can align as an industry to come to an agreement on certain things, which are going to be, if you go to dentalstandardsinstitute.com, you can see what we're working on.
Yeah.
Get involved. For example, it's, what the third most prominent reason for deaths in hospitals is?
Well, I don't know what the first two are.
It's like heart disease and another disease. I think it's heart disease, and I can't remember what the second one is. But the third is medical errors, miscommunications.
Wow.
Which are the number one cause of medical errors are miscommunications, and I looked at the reasons, like similar with VR when we're talking about dental anxiety and how Opera VR digital nitrous transforms the patient experience by the hateful 8, the top 8 reasons why people hate going to the dentist. I looked at what are the reasons why what are these miscommunications? And the number one by far is people not seeing alerts and issues with a patient because there wasn't an alert. So there's some type of a medical issue that the healthcare provider didn't look at because there wasn't an alert that popped up for it.
Sure.
And so why don't we make this easier to see and consistent across all of our practice management systems, right?
Yep.
We're working on that.
Yeah.
Right? That's the kind of thing that now that's in the medical office. Obviously, people, it's not going to be as dramatic of an outcome in dentistry, where we don't have people dying because of miscommunications that I'm aware of very often, right?
Well,
it can
got
happen,
allergies.
but the problem remains. Like, let's get ahead of this. Let's standardize things to the point where if I'm a temp hygienist and I'm going into a new office and I've never worked with that software before, I know exactly where to look to find crucial information, right?
Yep.
That's something we're working on, right?
Yeah.
And we have 9 standards that we're currently working on that I think that we can get ahead of several problems. Also, just make life easier for everybody in the industry, elevate patient care through getting in alignment, and also listening to patients and what they're looking for and incorporating that into our industry. Not just listening to them, also looking at things from their perspective and going, like you said, like the patients don't know that the risk of losing your teeth is higher when there's not a dentist looking at. I mean, we can't expect patients to know what we know, but we should listen to them and their perspective and then help shift slightly to incorporate what they want so that we can get ahead of it before it becomes problematic.
Yeah. Yeah, for sure. That makes sense.
So if you want to voice, if you have ideas of how we can help transform our industry to be in alignment with the patient perspective and also be ahead get up to pace where patients are now, which is the whole reason for this podcast, which is now extended into the Dinosaur Thinking Initiative, DSI, dentalstandardsinstitute.com. Thank you, sir.
Thank you, Bryan.